on YouTube, and he's a true tech whiz. Dylan, my nonverbal son, is one of the most empathetic souls you could ever meet, with a smile that can brighten anyone's day. He loves to help with chores, especially landscaping and gardening. With the right supports, every person has gifts to contribute to our society, and I firmly believe this. Making Making healthcare inaccessible to vulnerable citizens doesn't just endanger their lives, it stops their futures and the contributions they could make to our communities and our country. Disability is not something that only happens to other people. It does not discriminate. It affects people of every gender, every color, and every political affiliation. It can touch anyone at any time, whether it's a child born with autism, a neighbor who develops a serious illness, or an adult who's been in a life-altering accident. The truth is, unless you are in the very top percent of income earners in this country, no working class or poor person could possibly afford all the care that is required to survive, let alone thrive, when disability is a part of their life. That is why I'm here today. As a mother, my passion is to fight for a country where every vulnerable community, families with disabled children, seniors, people with chronic illnesses, or those living in poverty, has health coverage that is accessible and affordable. Medicaid is not charity, it is justice. It is the guarantee that we do not abandon people who need the most care. I am proud to stand here with Leader Jeffries and everyone who is working to protect and expand Medicaid, because protecting Medicaid means protecting families like mine and protecting the very values of compassion and fairness that we say this nation stands for. Wow. And now we're going to hear from Tony.
Good morning, everyone.
Morning.
I'd like to thank Congressman Jeffries and all the members of Congress who have given me this opportunity to travel from Pennsylvania to share my story. Again, my name is Tony Gonzalez, and I live in Indiana County, Pennsylvania, with my wife and my daughter. My youngest daughter, Amber Gonzalez, is with me to help lend her daddy some strength and comfort during this time. Roughly 2 years ago, I was diagnosed with stage 4 thymic carcinoma cancer, and I'm currently being treated for the cancer and receive chemotherapy, immunotherapy, and radiation therapy regularly. Fortunately, I've been able to purchase affordable healthcare through the Pennsylvania State Health Insurance Coverage Marketplace called Penny to cover my cancer treatment. Right now, I have a gold plan that has a low premium, all thanks to the ACA subsidies, otherwise known as the enhanced premium tax credits. But even with this low premium and the enhanced premium tax credits, my individual out-of-pocket maximum is still $7,500. Between my wife and me, the total out-of-pocket cost is $15,000. With my cancer treatment, I end up meeting my out-of-pocket maximum every year, and the costs do add up. I'm a full-time college professor for a small college in the Pittsburgh area, but I admit with some embarrassment that I struggle to even pay most of the co-insurance as part of my out-of-pocket responsibility. My wife also has chronic illnesses and is not able to work, so we really rely on the coverage to keep us in the fight for our lives. The enhanced premium tax credits are so critical to help us afford our health coverage. Without them, our monthly premium would jump from $234 to around $450 a month, which would put us in further financial strain, and we really already break even just as it is. We want to be responsible and pay for our health care, but if premiums go up or we lose the enhanced premium tax credits, we'll have no other choice other than to drop our coverage altogether or purchase a plan with a higher deductible and out-of-pocket maximum that won't meet our needs. I hope and pray that these subsidies don't go away, because if they do, we'll be forced to compromise paying some bills and run the real risk of medical debt. I'm not the only American facing these challenges. My circumstances are not unique, and I'm not alone in this health battle. Members of Congress, I and millions of Americans implore you to extend the enhanced premium tax credits before it's too late. Thank you for your time. I now yield to Catherine for some remarks. Thank you very much.
Good morning.
Morning.
My name is Catherine Henderson, and I'm a surgical oncology nurse at The Ohio State University Wexner Medical Center, James Cancer Hospital. I am also proud to say that I am a member of the Ohio Nurses Association, where I am the Health Policy Council Chair.
Handcrafted jewelry inspired by a magical realm. Mriganka by Tanishq.
Hospitals and clinics will be forced to close or cut essential services. And even those with insurance like me will face higher premiums. It could literally mean choosing healthcare or rent or groceries. And hospitals aren't just healthcare, which we all know is a fundamental right. They're economic anchors. When a hospital or clinic closes, the whole community feels it. The ripple effects, jobs disappear, schools and small businesses also suffer. The impact here is clear. If this crisis isn't resolved, these places increase burdens not only on patients, but the remaining communities to provide care where the capacity and nurses are already stretched thin. At the James, we take care of patients from across the country. Without insurance, I worry that someone's mother or father or other important family member would have to forego preventative treatment or further cancer treatments. Regardless of your political party, everyone knows that cancer doesn't discriminate and early detection is life-saving. In other words, no one will be spared from this hurt if Congress fails to act. Now we face the looming threat to shut down the government and lay off workers rather than working together to protect Americans' health care. Republicans control Congress and the White House. If the government shuts down, it's because there was a choice made. One that prioritizes politics over protecting health care and keeps our costs from rising. Our country, our patients, nurses, and families deserve stability, health care, and dignity, and we're going to fight for it. I urge Republicans to do the right thing. Work across the aisle to find a solution, one that protects health care, lowers costs, and keeps the government open. Thank you.
Good morning. Thank you so much, Catherine, for framing that discussion and ensuring that we talk about your patients, the people who you serve and see every day. Thank you, Tony, for sharing your story and being honest about the decisions that families will have to make about whether to carry forward with their healthcare costs, whether to pay their health premiums, or make difficult family decisions. And Teresa, thank you so much for taking care of your kids and being the anchor in the family that they need. When House Republicans passed their big ugly law, it was the biggest healthcare cut in the country that we have ever seen. And the fallout was immediate and it was swift. Hospitals and clinics across this country began closing. Patients started facing longer wait times and travel times. Healthcare workers began losing their jobs, and costs started to go up for everyone. At a time when Americans continue to struggle to afford everyday needs because of Donald Trump's tariffs, Republicans voted to take healthcare away to make it an expense out of reach for so many. Damage has been done, but Republicans can still change course. Republicans control the House, they control the Senate and the White House. They could act right now to prioritize the health care of the American public. That's why Democrats are in town. That's why Democrats are here. We're ready to work in a bipartisan way to keep government open, to lower costs, and to save health care. For months, we have been sounding the alarm that the Republican healthcare crisis that has been manufactured by House Republicans needs to end. Democrats know that unless Congress acts right now to extend the Affordable Care Act tax credits, the dual healthcare and affordability crisis will continue to get worse. These credits make healthcare less expensive for millions of Americans when they otherwise wouldn't be able to afford it. Democrats are giving Republicans the opportunity to do the right thing, a second chance to fix the crisis that they've created. Unfortunately, it seems Donald Trump and his Republican henchmen are hell-bent on pushing us toward a government funding shutdown rather than saving health care for their constituents. We implore our Republican colleagues to change course, abandon that approach, put people first, cancel your vacation. Cancel your vacation. Cancel these cuts. Lower costs. Save health care. Work with us. It's what the American people want. We will continue to work to ensure that Americans have the health care that they deserve, the health care that they've been promised, the health care that they have come to expect, so they don't have to make difficult decisions that affect their families, that put their communities in jeopardy. So healthcare clinics don't close and more hospitals don't close their doors. That's what we're fighting for. If this shutdown continues, this will be on the Republicans. Republicans in the Senate, Republicans in the House, Republicans that occupy the White House. This is a shutdown they will own, and the American people are paying attention. I'm so proud to stand with our House colleagues to demand that House Republicans cancel their vacation, cancel the cuts, lower the costs, and save health care. Thank you so much.